Chlamydia complications. Chlamydia is a common sexually transmitted disease. It is caused by bacteria called Chlamydia trachomatis. It can infect both men and women.
Chlamydia is a bacterial infection that's primarily sexually transmitted. Most folks who have chlamydia actually don't have any symptoms, but it can cause a lot of inflammation that can be uncomfortable and can also be associated with infertility. Symptoms associated with chlamydia include urethritis, so pain with urination in both men and women. In men, it can also be associated with epididymitis, so a painful swelling of the scrotum. Most of the time, women are asymptomatic, but can also be associated with vaginal discharge and pain with urination. Usually when someone comes in and we make the diagnosis of chlamydia, the treatment regimen is a single pill, sometimes associated with a single injection that we can also give in the clinic.
Applications in medicine. Because approximately 75% of women and 50% of men have no symptoms, most people infected with chlamydia are not aware of their infections and may not seek health care. If males have symptoms, it may include urethritis. If females have symptoms, they may include vaginal discharge and painful urination.
Now, if we look at the development of a cycle of chlamydia, we are going to see the pathogenesis in much more detail. Now, here comes the first step. So, let's say this is the large cell is the eukaryotic cell which is to be attacked by chlamydia. Now, here comes the elementary body. Remember, elementary body will come, which is acting like viruses. It cannot divide outside the cell, so they will come and attach to the host cell. After the attachment, they will guide the host cell to engulf them inside via the invagination or endocytosis pathway. After this endocytosis is done, this chlamydia or elementary body is now inside the vesicle, and they will start to thrive and start growing and dividing inside this vesicle. Sometimes they can also come out of this vesicle to the cytoplasm and then start growing and dividing several times. Now, as they are growing and dividing several times, as you can see here, right? So what we can see here, once after they are internalized, the recognition and they are converted into reticulate body. So once which was elementary body, after the engulfment staying there for few while, they will be converted to reticulate body. So their structure will be increased as well as they get the ability to grow and divide rapidly. So once they get this ability, they will grow via the binary fission process for 24 hours. Now for further this 24 hours, what we get more and more reticulate bodies and small elementary bodies. Now as we are getting more reticulate bodies here, those reticulate bodies will be now converted into elementary bodies, because if they want to release something outside, that should be elementary bodies, because reticulate bodies cannot survive outside the host cell, right? So now when they recognize it, it convert to the elementary bodies. Now inclusion contains both of them, elementary body as well as reticulate bodies inside them. Now what they will do, now they continue to reorganization, and after certain time, when they get the environment is ready to release all these materials, they will open this vesicle and it will release all those reticulate bodies outside. So now what we get, many more reticulate bodies coming out, and these reticulate bodies are ready to again attack another healthy host cell, and the cycle will continue like this.
Past infection with chlamydia does not make a person immune to chlamydia. Chlamydia is treated with antibiotics.
Helping make your life easier. Moms every day.
Good morning, I'm Katie Kunkel.
The words, "you have chlamydia," are ones you hope to never hear, but unfortunately they are all too common and many people don't understand the health issues related to the disease. Today, Rhiannon Riley, nurse practitioner in the Obstetrics and Gynecology Department at Mayo Clinic Health System, is going to talk with us about chlamydia and how it can lead to fertility issues for women. Good morning, Rhiannon.
Good morning.
So first of all, what is chlamydia and what are the common symptoms?
So chlamydia is a sexually transmitted infection, and it is commonly asymptomatic, meaning that people do not usually have symptoms when they have this infection. If you do exhibit symptoms, they can include abnormal vaginal discharge, pelvic pain, abnormal bleeding, and also pain with urination.
Okay, so how common is chlamydia?
So chlamydia is the most common sexually transmitted infection, and in 2013 alone, 1.4 million people were diagnosed with chlamydia in the United States.
Okay, so who should be screened then, and what can we do to prevent it?
So chlamydia screening really should be focused on younger women especially. They are at 3 times more risk for developing chlamydia in their lifetime, and we do recommend screening for women 25 years and younger, also with screening with new partners as well.
Okay, and so what are the possible long-term consequences of the disease?
So long-term consequences from chlamydia can include pelvic inflammatory disease, ectopic pregnancy, infertility or difficulty getting pregnant. Also, there can be infections in pregnancy that can lead to problems with the newborn as well.
All right, so very important to get screened. Thank you very much for
Yes,
joining
thank
me
you.
this morning. And to learn more, please visit weau.com and click on Moms Every Day. You'll find more information in the Health section under Women's Health.
Infection rates are highest among younger women, with the highest rates. First source of infection occurring in women between ages 15 and 24.
Hello, I am Dr. Rachel Gorwitz, Medical Officer in the Division of STD Prevention at the Centers for Disease Control and Prevention. Although most chlamydia cases reported are among teens and young adults, any sexually active person can get this sexually transmitted disease, or STD. In fact, CDC estimates there are nearly 3 million new cases of chlamydia each year. People get chlamydia by having vaginal, anal, or oral sex with someone who has this STD. Most people with chlamydia have no symptoms, which is why the infection often goes undiagnosed. If symptoms occur, they may not appear until weeks after having sex with someone who is infected. Women with chlamydia may have an abnormal vaginal discharge or burning sensation when urinating. Men with chlamydia may have a discharge from the penis or a burning sensation when urinating. Even when a chlamydial infection does not cause symptoms, if left untreated, it can go on to cause pelvic inflammatory disease, chronic pelvic pain, or make it difficult or impossible for a woman to get pregnant. CDC recommends that sexually active women under age 26 be tested for chlamydia every year. It is important for both men and women to discuss their sexual history with their physician to determine if they should be tested for chlamydia. Chlamydia can be cured easily with antibiotics prescribed by a healthcare provider. Even after treatment, though, a person can be reinfected if they have sex with someone who has chlamydia. So it's important that sex partners are also treated. Learn more about chlamydia and other STDs at www.cdc.gov/STD.
Conclusions. If a person is not treated for chlamydia, complications may occur. Women frequently develop pelvic inflammatory disease. PID can cause infertility, chronic pelvic pain, 2-week pregnancies, and the continuous spread of the disease. In men, untreated chlamydia can cause urethral infection and complications such as swollen and tender testicles.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also a sexually transmitted disease. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that so many it's so common for women to have discharges that they don't even notice that they have this. So nowadays the recommendation is that anyone gets before the age 24 gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it through a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia I don't think people would immediately think about.
Right, exactly, especially because it's such a silent disease. It's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tube have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture, and it's an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infections.
Can chlamydia, I guess, we're always talking about cures. Is this something that can be cured?
Yes, chlamydia is cured as opposed to any type of other things that we discussed, herpes or HIV. Chlamydia is easily cured with an antibiotic. Citromax covers quite easy. Now it's important that not only you get treated, but your partner gets treated because otherwise the infection comes back.